My name is Cass Nakasone. I currently serve as the section chief for the Department of Orthopedics at the Straub-Benioff Medical Center in Honolulu, Hawaii. I've been in practice for approximately 20 years, and of my knees, about 30% of my practice involve performing unicompartmental replacements. For those of you who perform unicompartmental replacements, many of the fixed bearing systems have the femoral cuts dependent on the tibial cut. So the tibial cut is very important that it be accurate and in the correct position. It is for this reason that I've chosen to use Lantern for my partial knee replacements. It doesn't cost me a lot of time, it's very efficient, and we found that to be very reproducible. So today we have a very classic patient who is a good candidate for a partial knee replacement with anterior medial arthritis and a slight varus deformity. In this case, we want to correct the deformity, but we don't want to overcorrect it and stuff the lateral compartment. So in these cases, Lantern comes in very handy to get the right amount of correction for the deformity and proper placement of the tibial implant. Placement of the external tibial cutting jig is easy to use, and it is important to align it with the mechanical axis of the tibia. Registration of the lateral and medial malleoli easy to do in order to identify the mechanical axis. I generally will set my tibial cut to be in about 1 degree to half a degree of varus, and my tibial slope to be somewhere between 3 and 4 degrees or 4 and 5 degrees. Because this is a fixed bearing implant, I think it's important that the tibial implant be relatively perpendicular to the mechanical axis. This low profile cutting guide is easy, and they have a low profile stylus which will help you determine the depth of your cut. I usually choose to measure from the lowest point of the tibial plateau where the wear is the worst, and I'll determine my depth cut from there. Then we make the sagittal cut, which is relatively straightforward and similar to using any other type of external tibial cutting jigs. And the coronal cut is made through the captured guide. Once the jig is removed, the wafer of bone is removed in the normal fashion. Lantern gives consistent cuts, and you'll find that it may cut down on the amount of time it takes to trial, since the cuts are very reproducible and you can measure the wafer that you remove. So we find that this has produced very consistent results. And as you can see, the Lantern tibial cutting guide gives us very consistent results. All of our unicompartmental replacements look very similar to this, where the slope and the varus valgus angles have been very consistent, and you can see that we've achieved our mild correction of the deformity. So Lantern has provided me with a high technology solution for the performance of unicompartmental knee arthroplasty, which has been efficient and does not cost extra time, but has provided reproducible and consistent results. We will continue to use Lantern in the future, as it has provided our patients with a feeling of confidence that we're using some type of high technology in the performance of knee arthroplasty without the sacrifice of time or efficiency.